and we'd like to tell you about the charity that helped change our lives.
Yay!
I was diagnosed with breast cancer in October 2016. My treatment was very fast because it was aggressive, so I had chemotherapy, surgery, which was a full mastectomy on the right side, and then that was followed up by radiotherapy to make sure that they'd zapped all the cancer that was possibly there. I think you prepare yourself for the bigger things, but because of the healing, but then also the scarring, I didn't realise that scarring would have that much of a restriction on me. So that was a tough time. The thing that really made it come home to me was the fact that I couldn't get a mug out of the cupboard in the kitchen to make a cup of tea. I couldn't reach that far up, and that was hard. But it was the little things that you don't realise, and it is things where you reach too far or you can't do a zip up, or my clothes all changed because I was a different shape and I couldn't put certain clothes on, and I didn't feel comfortable in certain clothes.
Hello, my name's Michelle Scott Worthington. I've been an exercise teacher for the past 30 years, and with my friend here, Lynn Shell, we co-founded Supporting Confidence Through Exercise and deliver In the Pink, the breast cancer rehabilitation programme. The In the Pink programme is a programme that is based on Pilates, but it is so much more than that. We do 8 weeks of various rehabilitation exercises, which is combined with them having experiences of different activities, and we'll do different activities such as African drumming, belly dancing. We're even looking at hula hooping in the future.
I heard about the In the Pink programme through being on another course and talking and getting to friends with the people that were on that course, and they'd seen it advertised in a local, I think it was the local Loughborough newsletter, and they just sung its praises. So I thought, well, sounds a bit scary exercise, but I thought, well, I'll phone what turned out to be Michelle, and the rest is history. I'm just so glad that I phoned Michelle. She was just on my wavelength. I had fantastic support from my consultant surgeon and my nurse, who did tell me what to expect, but of course that's not their area of expertise. And to have somebody there that was for not just the physical but the mental, because you just regain your confidence that you can move again, but also to have somebody that you trust, because I did think about going to an exercise class, but I might do some more damage, where in the Pink you know that you're being watched and trained properly, but it was the confidence, especially at a really difficult period of time. And just to be in a group of people, that's scary. It was a new me. Since the In the Pink programme, I've carried on with the Pilates. I've managed to get back to my gardening. I've actually taken up Nordic walking a little bit, like in the local park or just with friends. But it's the confidence, it really is. And knowing that if I do feel pain or I feel a bit stiff, I can remember what I've been taught in the Pink to actually know what I'm doing well, or actually when I think I need to go back and ask for some advice. So it's just been a confidence booster, and I don't think without it, I couldn't even have got back to baking, because I just couldn't mix a cake without having the exercises. You just don't realise you lose so much. So yeah, it's been good. If somebody came to me and asked should they join the In the Pink programme, my answer would definitely be a yes. I would think actually it would be just have a word, have a chat. If it's not for you, it might not be the right time now. It doesn't have to be now, it can be months, years in advance. But I would say give it a go. Everybody treats you as an individual. You're amongst people that understand, you're amongst fellow patients, and when you come out of hospital treatment, that's what I missed. It was having those peers that actually understood what I was doing. So you get your confidence, you learn something new, and most importantly, there's tea and cake.